Hey everybody, it's Dr. Lloyd here at Adjust Clinic in Petaluma, California, where we take a special interest in helping people with whiplash injuries, car crashes, slips and falls, whatever causes a neck injury. We take an interest in that because I think we got some good tools to help you with that. Today in this presentation, we're going to talk about the secret connection between neck injury and neck recovery in Petaluma. Now, only Petaluma because this is our area where we practice, but the stuff I'm going to talk about in this video is going to be applicable to all people in California, in the United States, in the world who have been in a whiplash injury, rear-ended in a car crash that has caused neck pain. This is going to apply to you too. Now, I've been in practice for over 20 years, and I've been in whiplash injuries myself too. And over the course of 20 years, both being rear-ended and having my own share of neck impact, along with learning about whiplash injuries starting in my first month of chiropractic college, all throughout the past 20 plus years, I've seen my share of neck injuries. So today we're going to talk about the car crash impact and what happens to your neck when that happens. Now, to be clear, a whiplash injury, getting rear-ended by somebody else, that is going to cause a lot more than neck pain in most cases. Getting rear-ended by somebody else causing whiplash to the neck also can cause low back pain, shoulder injuries, knee injuries, concussion. All kinds of problems can happen in the rear ender. But for this presentation, we're going to talk about the neck and neck injuries. And we're going to talk about the effect of the car crash on your neck injury and how it happens, what parts get injured, and what you can do about it. So, when you're sitting in traffic, Bay Area traffic, sitting at a stop, and not paying attention because you are in a stop and go, you're not aware that somebody is barreling behind you, unable to stop in time. Maybe you hear a brief skid noise before they hit the back of your car with their car. This collision between their car and your car transfers a lot of forces between the two. And if you're lucky, you're in a car that was built in the last 10 years with a good crumple zone and good engineering, paying attention to whiplash dynamics. You know, when I was in chiropractic college in the late 90s, I did a presentation for the class talking about head restraints and what car makers had good head restraints and what car makers didn't have good head restraints. And back then we called them head rests because we didn't know what they did. But they're there to restrain your head from going too far back in a whiplash injury. Back then there were only 2 car manufacturers that passed the test and had good head restraints. The first one was Volvo, who had a fixed head restraint that had the proper shape to it that brought the head restraint closer to the back of your head. And the other one was Porsche. Porsche had a good head restraint in all their cars because it was a fixed head restraint. The rest of the car manufacturers didn't seem to really care. Now I'm pleased to report that in 2023, most cars have a good head restraint from what I can tell. The car I drive has a fixed head restraint. But this graph right here represents what happens to your neck in the first split second after you're rear-ended by somebody else. Now, on the left here, NP means neutral posture. This is when there are no forces going into the car yet. But then, 25 milliseconds in, after the accident, you can see that the shape of the neck is starting to change. 25 milliseconds after you get hit, the back of your seat pushes your mid-back forward. What this does is it compresses the curve in your mid-back, which also sends a compression force up to your neck, compressing the discs in your neck, compressing the facet joints in your neck, and it interferes with the normal C-shaped curve of your neck. This compresses soft tissue. 50 milliseconds later, and this is just like a small amount of time, you can see in the diagram that your lower neck goes into hyperextension, again compressing some of these joints in there in the lower neck, but also your upper neck happens to go into flexion. This causes an S-shaped curve, which is very unnatural for your neck. At the top of the neck, at 50 milliseconds, there is rapid distraction of the ligaments and muscles in the upper part of your neck, while the lower part of your neck is getting that compression forces. And then 75 milliseconds, 100 milliseconds later, your whole neck goes into hyperextension. This is when ligaments in the front get torn, muscles in the front become bruised and strained. The compression forces in the back of the neck can cause soft tissue swelling, bruising in the areolar connective tissue that surrounds the ligaments. Hyperextension at 125, and then at 150 milliseconds and 175 milliseconds, that's when your neck finally gets projected forward. And we don't see what happens after that, but we assume with a bad enough injury, you're going to go into hyperflexion. So this is the sequence going from hyperextension to reaching hyperflexion. And the important part about this diagram is that it takes 200 milliseconds for the reflexes in your neck to make the muscles in your neck respond to what's going on there. So all of this transfer of forces from the pickup truck that hit you behind you, smashing into your Miata, happens without any muscle guarding. You're absorbing the forces of that impact in your neck. And so you can see how this is going to leave you with bruising and swelling and torn ligaments. This next diagram shows on the left bones of the neck and how they should properly be oriented, the C-shaped curve in the neck. And then the second one shows when there's discs added in there, blood vessels, the vertebral artery going up, and the nerve roots coming out of the foramen on the side of the neck. You don't see it in there, but the spinal cord runs down from the brain down to the rest of the body through the neck. And this sort of just underscores about how much of a potential injury can happen with a bad enough whiplash injury. The diagram on the right shows fractures of the articular surfaces. The joint capsule has active swelling within it. There's a contusion of the intra-articular meniscus. There's a meniscus, which is a fold of soft tissue that goes into the joint that gets smashed together, causing a bruise. We've got a rupture of the facet capsule. In the front, we've got an avulsion of the end plate between the disc and the bone, so that it actually separates, causing more bleeding. And when you have that, you have ligament damage in the front. The front part of the bone has ligaments that hold it together, but those become torn when this gets torn. And the side, this is a cross-section here of the disc, which can show a protrusion of the inner part of the disc called the nucleus pulposus. So these are some of the common bony injuries in the neck that can occur with a bad enough whiplash injury. Now, most of the injuries that I see in my clinic don't have these fractures going on, or you can't tell there's a fracture. Unfortunately, bones heal much faster than ligaments, as we'll see. But these are the common injuries within the neck. And these are unseen injuries. These are invisible injuries. You're in wincing pain, making it hard to move your neck, look around, even like put your shirt on or take your shirt off, take a shower. You can't see the injury. There's not a lot of swelling in place, but you can kind of feel it when you touch it, and you definitely feel it when you move your neck around. These injuries aren't visible. You don't see the bruises. Again, when your neck goes into this S-shaped curve, you can see normal alignment on the left here. This is normal alignment. The articular surfaces are lined up well. But when there's a hyperextension to your neck, there's distraction at the front part, but there's impaction at the back part. This normal alignment becomes altered with a whiplash injury. And facet joint injuries are one of the biggest pain generators after a whiplash injury. This is that hyperextension where these facet joints are closing down on themselves. And when this happens, you can see the referred pain patterns in common, you can see the referred pain patterns from the facet joints. So at C5, C6, those facet joints, you can see that's like on the side of the neck, but also it's getting into the trapezius in the shoulder, the upper part of the shoulder blade. C6, C7, you can see referred pain down into the shoulder blade. The top of the neck, C2, C3, you'll get a headache starting at the base of the skull, wrapping around the head. And here's one of the secrets too. When you have pre-existing arthritis in your neck, you're going to have upper neck injuries because the arthritis down here is preventing too much movement. When you're younger, you'll have lower neck injuries, more common than upper neck injuries. So these are, again, more injuries in the neck that we talked about. Facet joints are the big part of the pain in your neck after a whiplash injury. Facet joint capsules become bruised, they become torn, you have compression forces on soft tissues in and around the facet joints. This makes it hard to extend your neck when you're injured. It makes it difficult to go forward too, but that extension is particularly painful in this case. And these are the first signs of discomfort after a whiplash injury, neck pain. And it can take the first 24 to 48 hours for that pain to really ramp up. And this is the most painful part of the whiplash journey as far as the neck goes. These are the initial symptoms. But later on, these symptoms can turn into something more like nerve compression type of symptom. Again, here's the referred pain from the facet joints. The facet joints are the most commonly injured areas in the whiplash injury. And so when this happens to you, you want to find the right clinic. And the right clinic is a clinic that understands these injuries. Here's a better understanding of how these injuries occur. Now, this shows a sports injury, but the same principle applies for a whiplash injury. This top row shows a muscle strain. The middle row shows a ligament sprain, and the bottom row shows a fractured bone. Now, we saw back here we had microfractures in the bone, and if you have that going on after a whiplash injury, you can rest assured that bone heals pretty quickly compared to these other tissues. Bone has a great blood supply. They're built to be immobile. If you have a fracture that needs mobilization, it's going to take longer and it's more of a different kind of journey. But if you've got microfractures in the bone, they callus up and they heal pretty quickly. Soft tissue includes muscles and ligaments. They take a little bit longer. Now, muscles have a really good blood supply. They have a good blood supply because they are metabolically active. So when you tear a muscle with a strain, it heals much faster than the ligaments because the ligaments are pretty metabolically inactive. Not a very good blood supply to ligaments. They take longer. How long? Well, this diagram, this chart shows at the bottom how many days of recovery time you should expect. And you go through phases of healing. You start out with the inflammation phase during the acute stage of healing, day 2, 3, 4, 5. That is followed by proliferation and remodeling. But you can see how this chart goes out 45 days, and then there's a cutoff where this stage of remodeling extends up to a year or more, depending on the severity of the injury. Now, this is for a ligament. Muscles heal much faster, but muscles are still within this timeline of 45 days. And this is why in our clinic, you might see me a lot in the first 30 and 45 days in the care plan, but we might see you for about 3 months before we release you to a more active care program that you can do at home. But the stage of healing is important to understand throughout this journey. Inflammation is this part right here, active inflammation, where the ends of the soft tissue are torn apart. Blood migrates in there, blood cells, white blood cells, red blood cells. It creates a clot, and from within that clot, there are certain factors that get released that set down a framework of loose connective tissue that allows fibroblasts to come in to lay down collagen fibers, eventually leading to this remodeling stage where you regenerate the soft tissue. You're regenerating the tensile strength of the soft tissue, and you have what's called the fibrosis of repair, which leaves you with some scar tissue. But you want to optimize this healing process by better movement. Platelets, fibrin, neutrophils, this all occurs in the acute stage of healing. Macrophages, lymphocytes, these are white blood cells. But these send signals to the rest of the body to lay down proteoglycans, fibroblasts. The fibroblasts are cells that lay down collagen fiber. So as you continue down the healing journey through that first 45 days, these are the cells involved with that recovery. The collagen fibers end up getting laid down, and that is this part right here, where you are creating normal connective tissue again. So chiropractic care is there for you throughout this healing journey. The goal of chiropractic care is to restore mobility, restore and stabilize neck posture. Chiropractic care is going to help speed up muscle activation to change fine motor programming, fine motor control of your neck. Chiropractic care helps promote decreased resting muscle tone when you have pain. And chiropractic care also helps promote stronger muscle activation when you need better muscle activation. This mobility that you gain with chiropractic care helps realign those collagen fibers throughout the healing process. And it's not always a forceful adjustment. When people think of chiropractic care, they think it's the adjustment only. Chiropractic is a profession that has different types of modalities, just like physical therapy is a profession that has different types of modalities. And a lot of that is shared between the two professions. So with chiropractic care, you might receive heat and muscle stim in the beginning stages of healing to help soothe the active inflammation, but it segues into active participation in your health, where you're doing home exercises or in-office exercises that help promote muscle contraction and muscle healing. So chiropractic care is more than just the adjustment or mobilization or stretches that are done to you, but it's other modalities too, as well as education like this. Now, in a whiplash injury, if you're not at fault, you had a wrong done to you and you want to make it right, well, then you want to seek legal help. I'm not here to give legal advice, but I do work with a lot of attorneys throughout California, and I work with them on liens. We tailor our treatment plan for the patient's needs, and we put all that care on a lien. So if you're an injured person, you don't have to pay out of pocket for your care. When your attorney settles the case, writes a demand letter, receives money from the at-fault party's insurance, then the money received from there takes care of our lien, pays for our services, as well as with the rest of the disbursement, whatever else happens during the legal process. So I hope that helps you understand neck pain after a whiplash injury. We're here to help you embrace a pain-free life. If you're in Sonoma County, in the Petaluma area, our office is Adjust Clinic. We're on Lakeville Highway. The number here is 707-658-2534. In a whiplash injury, do not delay your recovery. Talk to us as soon as you can. See you soon.